Soreness, muscle aches, fever, and tiredness are all common side effects of the COVID vaccine and tend to be worse after the second shot. But some people are reporting other flu-like symptoms. If you do experience symptoms that are not common to the vaccine, the Alabama Department of Public Health recommends checking in with your doctor.
If you start having cough or sore throat or runny nose or other symptoms, that's not from the vaccine. That's more likely to be some other illness and potentially could be incubating COVID.
Severe side effects are more common in younger adults because they have a more robust immune system. But health officials say symptoms from the vaccine should go away within a day or two.